Hi, welcome to Dr. Kayhan Show. I am Selim Ulusoy and I am the presenter of this program. Today we have a lot of questions to ask to Dr. Kayhan. We are going to talk about COVID-19 and hepatitis. Dr. Kayhan, what is COVID disease?
This is a kind of virus invaded person to person with inhalation or inspiration way. It's also taken from some wild animals in forest. It's an RNA virus, and it's the reason of Corona-19 diseases. It's firstly localized in nasal septum and mouth, then pharynx, then it affects lungs and inspiration system.
Is it influence any other systems in body?
All the body, it's invaded all the body, and it's an interesting viruses. But the main problem is it increased the coagulations and increased embolies all the body. It increased myocardial infarction and brain hemorrhage, and some other problems, some coagulation problems. Also, we know that it affects some neurological disorders in the body. For example, 5 days of acute attacks of COVID, then a man has a Guillain-Barré. This is a bad neurological diseases. He doesn't any story about it, but after COVID, this kind of neurological disease started easily.
Is it increased heart attack?
Yes, it increased acute myocardial infarctus, and it's invaded. It affects all kinds of ages. For example, we have a case. He died from myocardial infarctus after the 5 days of COVID infection.
What is cytokines?
This is the all kind of symptoms, reasons in COVID diseases. These are simply immunological parameters in our body. This is one kind of peptide, but it is used for all kinds of enemy, for example, allergic materials included, which attacks our body. But if they give much more reaction when we can wait, it can be damage our body. So all COVID illnesses have the risk of coagulation in the vessels, rheumatic and neurological illnesses, and these are all effects by cytokines.
What are the risk groups for COVID?
Everybody, but it mostly affected some special groups, males, 50 and 60 years age, or much more older, some renal diseases, chronic renal diseases, and some diabetes, also hypertension, and chronic renal diseases are all affected easily COVID. Also, hematologic malignancies easily affects from COVID.
Okay, how can we protect us from COVID?
Uh, Simple or hard? Simple because everybody do it easily in everywhere. Uh, you can't be special. Hard because you will do it a long period and you can forget it, these rules. What is these rules? Firstly, we must use masks in a closed place, and we always have 1.5 meters distance between us. This is the limit to affect inhalation of these viruses. Also, every time we must usually washing hands and faces with soap or detergents. The main factor you see there's cleaning, but in the human lives, human faster lives, we can easily forget it. So it's invaded easily to us.
Okay, Dr. Kayhan, for example, if somebody is COVID in our house, what will we do to protect us?
We must isolate him in a room, and he or she lives only in this room. We must give his or her meal outside preparation, and he or she doesn't use same kitchen, same bedroom. Also, every time opening the windows and fresh air. Yes, and also every time cleaning and make bed to protect us from these illnesses.
What do you think about and what would you say about the vaccination?
Firstly, we must, if you want to win this disease in the world, this pandemic, we must vaccine everybody. But there's some problems also about vaccinations because we produced it in a short time and we don't know its long effects in the humans. Firstly, this RNA vaccination. This is a kind of living viruses. We give it to your body. We don't know how can it be in the future after 10 years, after 20 years. Maybe it can start some immunological diseases. We don't know it.
Is it finished in 1 year or another way? Will human be controlling this year in 1 year?
I don't think so. We all hope, all clinicians, all doctors hope to control it in a 1 year, but we know that there's a lot of mutations of these viruses and it's invaded person to person easily because we are social creatures. We are happy with living together. And we are not alone persons like Lucky Luke. If you want to be happy or for example, furniture in a if you want to be upset or sad, you divided your happiness or sadness with the other peoples. This is the social lifestyles of us, and COVID loves this. If you sit near to somebody, this is a simple human behavior. COVID wants it because it connects with the other people easily. Also, we have a life with religion. All religions doing much more people, and COVID likes these areas. Yes, this is the main problem of these illnesses.
Is there any diagnosis method?
Yes, there's a lot of. We developed much more. Much more specific one is a thin stick. We put it your nasal orifice or mouth orifice, and we make culture of it. We take answers in 48 hours, or a speed way. This is not means that if this test positive serology, if this test positive means that you saw these verses before, or now you have these verses. And the last serological model is developed in China. We take examples from anuses, rectal examination with a thin stick, because we know that your COVID illnesses is finished in your body, but 3 weeks its viruses continuing in your stool.
Really? Okay, is COVID affects animals or plants or fish?
Etc. Yeah. COVID is a zoonotic viruses. We know it because it's coming from the deep forest beds. And this is the corona group, COVID, and corona is the illnesses of zoonotic viruses. Also, all our pets are vaccination every year for the protection of coronaviruses, but they are not protected from this COVID-19. It's coronavirus, corona group, it's in corona family, but COVID-19 doesn't affect this coronavirus vaccinations in pets, and also it easily invaded animals from us to animals, and they also easily died from this disease.
Okay, do you believe quarantine for COVID?
Yes, quarantine means 40 days in an Italian word. It is developed, this word, at middle age, when the ship is coming port. If there's a rubellus in it or not, to understand it, they make quarantine 40 days out of the port, this ship, and 40 days later, if there isn't any rubellus, okay, you can come to stay. We use quarantine also. Long quarantine periods are easily affect human neurologic and psychological system, and we see it now easily because Alzheimer is too much increased. Older persons doesn't see the other persons, and they don't take any good effects, and they are closed in your neurological life, and Alzheimer increased. And also depression is much more increased because I said it before, we are a social peoples. If you are not social, you are not human. This is the differences of the other living animals and plants. This is the differences of us. And we know that depressions and anxiety is much more increased.
Okay. Is it infected in foods?
No. For example, if somebody COVID and give you a hamburger with his hands, it doesn't affect you. If you have enough social distance, 1.5 meter or etc.
What kind of foods will increase our
Immunological protection. This is the same answer for all viruses. First one is yogurt, probiotic yogurts, kefir, some fruits which included more vitamin C. For example, orange, mandarin, kiwi, grapefruit, etc. Also, more drinking liquids, water, and echinacea. Echinacea is also a good protection from all kind viruses.
Okay. Is there any medicine for the treatment?
Maybe it will be future, but not now.
Okay, another subject, hepatitis. The most popular reason of hepatitis, and what is hepatitis?
Hepatitis is the inflammation of liver, and there's a lot of viruses affect liver. Liver is an most important organ in our body because if you think brain is a government, a chief of government, and your heart is your factories. Liver means is your banks, federal banks, your economics. If you have economics is bad in your country, everything is bad. So this hepatitis viruses is affect only liver.
Okay, could you list them for us, please?
Yes, some specific ones is hepatitis A, B, C, D, E, and G, and also the other viruses, Epstein-Barr virus, Stomagalovirus, herpes, corona, also brucella, some drugs, HIV virus, some rheumatological and immunological diseases, also Ebola, Lassa, mumps, rubella, pox viruses are all affects liver.
You said COVID, isn't it?
Yes, correct. We know that after COVID, all cases, liver is always affected and liver enzymes are increased.
Could you talk about the virus of etiology?
Etiopathologist, yes, sure. Hepatitis A, C, D, E, G are all RNA viruses. Hepatitis B is the only one DNA virus. This is an interesting virus because we find this virus in some dead people, Egypt dead people in Cheops pyramids also. This is an older virus. Hepatitis A and E are invaded only enteric way. The others invaded sexual or blood way.
Okay, what is enteric way?
Virus went to our body by oral way, by mouth, and also corona goes to same way. This kind of viruses are also seen in the stool of these cases. They are invaded the other patients by this way.
Which are the hepatitis viruses infested by blood and sexual ways?
Especially hepatitis B, C, D, and G. G doesn't make a bad illnesses, but we know that hepatitis B, C, D is a big problem, such as corona.
Okay, which of them will be chronic?
B, C, D.
What is the clinic of hepatitis viruses?
In acute period, it all looks like a flu. It's starting with weakness, coughness, photophobia, headache, myalgias, vomiting, emazes, fever. After these symptoms, they are all disappeared by icter starting. Icter means is your sclera of your eyes is turning to the yellow. We called it icter. And if it started, these symptoms is disappeared.
What is fulminant hepatitis?
Fulminant hepatitis is a big problem nowadays because it's only treated with liver transplantation and acute liver transplantation, and we can't find easily these livers. Simply, this is the acute liver failure. Its mortality is approximately 60%. After starting the infection, first cerebral edema will develop, then hepatic encephalopathy, some coagulopathy problems, lethargia, stupor, coma, confusion, insomnia, speech disorders, and then some coagulation problems in vessels. At last, multiple organ failure, ARDC, and will develop. And after that, if you not make liver transplantation, it will be mortal for persons. The main problem is the, fulminant hepatitis in the world. We know that hepatitis A, B, C, D, all of them make this, but also some medicines, drugs, pills, which are used to treat us, easily make this kind of fulminant hepatitis. So we every time tells the persons don't use if any medicine doesn't give from doctor.
Okay, what are you telling about hepatitis E?
This is another RNA virus. It's an interesting virus. It only affects pregnant women in the third trimester, the last period of pregnancy, and it makes me mortal during this period. It makes fulminant hepatitis also. It's infected humans by enteric way, and it is also invaded in Africa too much. We know it. It looks like hepatitis A viruses too.
Okay, which of them is most in the world?
Hepatitis A is the most one in the world, and because mostly in childhood period, we think that we are flu, but during this period we take hepatitis A, and hepatitis A behave like a flu, and we win this war, and then we have a continuing serological anticorps to protect us, the other hepatitis A, in our life forever.
What about A, hepatitis A?
It's an enteric virus. It infects by fecal oral way. It only affects liver. It can't be chronic. Mostly it affects humans during childhood period. It's any specific medicine, but prophylaxis is important. We can use dead vaccine for active immunization. It makes 2 times with 6 months period for active immunizations.
Okay. Last one is B, C, D. Hepatitis B, hepatitis C, and hepatitis D.
Uh, First, I want to talk about B virus. It's only DNA virus in this group. It infects by blood and sexual way. It is treated by pills. These are antiviral pills, according to the hepatitis B, but these pills only stop its chronic effects to the liver. If you don't continue drinking these pills, hepatitis B makes change the liver to the cirrhosis. It only stops this cirrhosis, and you must use all your life period. We can protect ourselves with vaccines. It must be repeated 3 times for real protection. After the first month, you must be repeated second month and repeated 6 months later. And also, every time you must control your serological way blood tests every 10 years. If it is decreased, you must repeat your hepatitis B vaccination again. Hepatitis D is not a real virus. It looks like a viron. What is viron? Viron needs another real viruses. What is real viruses to infect us? This is hepatitis B surface antigen. If you have a porter of hepatitis B, or if you are a chronic disease of hepatitis B, hepatitis D will be infect you, and these two virus make your liver changing your liver to the cirrhosis and also liver cancer. It is treated with interferon. Interferon is also a stoking. It must be continued minimally 10 to 12 months. If hepatitis B infected at childhood period or during your perinatal period is you are living in the abdomen of your mama, and it will be chronic. If it transmits during adult period, it can't be chronic, we know yet. Hepatitis C is another RNA virus. It is usually affects drug addicts in all over the world, and approximately 10 years ago, hepatitis C is our main problem in the hospitals, but now we can treat it with some pills in approximately 8 weeks, and we stop this disease easily. Also, hepatitis C virus make chronic liver disease, cirrhosis, and liver cancer. It doesn't have any vaccine. It was seen mostly drug addicts before I said, and when it infects you, you can't understand it. It stay 30 years stable, and after 30 years, one day you see you have a cirrhosis. This is a surprise of it, but we can treat it easily with pills now.
Okay, thank you, Dr. Kayhan. This is the end of our program. See you next episode. Bye.